everyone, I'm certified chiropractic sports physician Mark Ullias. Welcome to a special edition of the Doc is In. Obviously, I'm joined by two young ladies here, Dr. Darty Sheth, local general surgeon, and Tommy Zito. How are you? Today's show is going to be geared especially to the ladies at home, but could be men as well. But it's going to be on breast cancer. And Dr. Sheth, let's begin with you since you're a surgeon. Let's talk a little bit about your educational background and some of your specialties and interests, and then we'll get a little more specific with Tommy's story.
Well, I schooled at Wayne State University for undergraduate, went on to medical school at Wayne State University as well, and did my general surgery residency at St. John Hospital. That was 5 years of residency for general surgery, but I took a special interest in breast cancer and do a lot of breast work now.
And you're in practice with your brother. Does he do the same procedures? Is that more your specialty and he handles some of the others? Or?
I think I do a little bit more being a woman, and women feel more comfortable seeing a woman, but he also does breast work. But as general surgeons, we do a lot of other types of surgeries as well. We practice out of two offices, one in St. Clair Shores and the new office in Shelby Township.
Which I've been in personally, and
it's beautiful.
Top of the line doesn't do it justice. Whatever's above there, is where you guys are at now.
Right.
In fact, I'll probably be there on the way home. And Tommy, here's a little card here called She Rocks for Cancer. And let's tell the people at home exactly what this is, and a little bit, let's give them a background of what your story.
It's an organization that I developed. I'm a breast cancer survivor, and I was diagnosed in 2006. And I was misdiagnosed a few times before I was diligently to continue finding out if I had it or not.
Misdiagnosed how?
Mammograms, ultrasounds. They said I was completely fine. I just had a feeling. So I went to a breast surgeon, and she found it right away. And it was stage 2, very aggressive. So I did all the procedures. I had a double mastectomy, reconstruction, chemotherapy. And I'm here just to tell people that it's very, you need to really have early detection. It's really most important.
Now, she made a comment, breast surgeon. Is there such a specialty as that? You may have an interest maybe more in that, but are they still general surgeons with a special interest in that?
It is coming about. There is a fellowship in breast surgery, but those of us that have schooled a while ago, we basically have developed a specialty within it, and it's more of interest and experience that leads us to where we are.
Let's start off, you and I have talked a few times. This is really the first time we've met. What is the incidence of breast cancer as far as percentages in women, various age groups, et cetera?
It's 1 in 8 women will develop breast cancer in their lifetime, which equates to about 12%. So it is quite prominent. It can also occur in males. Obviously, the incidence is much less, but they are usually detected much more aggressively. Their tumor is further along than women because of the not having the detection on a regular basis.
Is it easier to detect in a male? Since, if you're a weightlifter, obviously you have muscle issues, but is let's say, similar sized tumors in men and women, is it easier in men?
It would be to a certain extent, but I think the fact is...
It's not in the thought process of a man.
Exactly. They don't think about it, they're not looking, they're not doing self-breast exams, and so usually it's found much later.
It's not done as a yearly physical either, is it, in the man?
It should be.
Okay.
It should be part of it, but I think it's overlooked in certain circumstances. I think males, the prominent issue is always prostate cancer rather than thinking about male breast cancer.
And so you kind of had this feeling, let's say.
Right.
Women have that. My wife with the kids, they have this like sixth sense, if you will.
Yes.
And you just felt something. Did you feel anything?
I felt a sharp burning pain that came and went. Something I could have lived with, but it just was a little different than what I normally would feel.
Is that something that would make you wonder right away?
Well, actually, I give kudos to Tommy for actually going after it, because most of the time when there's breast pain, we don't think about breast cancer. It's usually benign causes. So it's great that you kept going after it.
How many different tests? You said a lot of
was
there nothing there and it just was overlooked, or?
After I went to the breast surgeon, it showed up on her ultrasound immediately, and I guess there's different machinery. There's different equipment. There's digital, non-digital, and I went to a bad place. But I'm glad I continued on, and she found it.
Not everybody likes every restaurant, and there are preferences. Certain doctors, you wonder, maybe it's a financial concern. It's really, what is the saying, teach a dog new tricks. I mean, sometimes you get used to a certain method. What is the method you prefer?
Mammography is still the ultimate screening test. So mammogram once a year after the age of 40, and if there is any concern, mammogram's not 100%. You can have up to a 7% false rate. So if there is still concern based on physical exam, we'd follow it up with an ultrasound. And if necessary, MRI is also coming into play as well.
What's the most sensitive
For screening purposes, mammogram.
for as far as a diagnosis?
Correct.
Okay, so even more than an MRI.
Right.
In the new office, I know that thing is, as they say, my daughter said yesterday, we're looking at shoes, it's tricked out. I'm like,
beautiful.
don't start with this. Yeah. So, but do you have, I think Dr. Morielli, who was one of the principals over there, mentioned that you are having a mammography. Is that in your office or more the imaging center?
In the imaging center,
Okay.
and there is also MRI capability, and they also have ultrasound capability.
Yeah, we did an intro over there a few months ago, and one of the, and I'm sure it was attractive to you, is if, let's say, Tommy comes into the office, you were the breast surgeon, if you will, and, you sent her down for a mammography, and, if there's a concern, you could have the report in her ear in a matter of minutes.
Correct.
Versus the usual method. So let's, I'm going to kind of sit back. This is, you're going to tell your story, you're going to tell, what really goes on. It's not just about a diagnosis. I mean, it's something that I'm sure it goes to, as Tommy would know, and as you hear, it goes much deeper. Not just literally, but I mean, the emotions are a part of this as well. After you heard the diagnosis, Tommy, what was your first thoughts? I'm sure fear.
I thought I was dying. That was it. And I just didn't hear anything after that. So as I proceeded, the very next day I was in an office doing, meeting with the chemo doctor, the radiation doctor, the breast surgeon, the plastic surgeon. My head was spinning, so
Within 24 hours?
the very next day.
Was that here or down in
It was
Florida?
in Boca Raton, Florida.
Okay.
And I brought my boyfriend with me and a friend because I couldn't hear anything. They took all the notes, and we went to a multimodality, the Boca Raton Community Lynn Cancer Institute. It's a multimodality. They have everything there, and you just sit there and they bring everyone in for you. And then you choose your doctors. You have options. So for the next 2 weeks, I interviewed all the doctors and chose the ones that I liked the best, that I felt comfortable with, and scheduled the mastectomy probably 3 weeks later.
I think Dr. Sheth, you feel comfortable with her already, so she
Yeah.
probably would have been your choice.
Absolutely.
Down there.
In fact, my breast surgeon was a woman as well.
What is the percentage of that? Would you say male surgeons as far as specialty in breast versus female?
I think there's more female breast surgeons, but that just comes into play because women want to see women a lot of times. There's a lot of good male breast surgeons out there too. But I think you hit on a lot of key points, is that you got involved in your care, and that's very important. I think as surgeons and physicians who are involved in breast cancer work, it's very key to allow patients to take an active role in their treatment.
Has that changed in 20, 30 years? I know at least in my office, a lot of people, they just want to be helped. They want to feel a little bit better. They don't necessarily are interested in doing the things at home, that could help it. They just want to get out of pain right then. Let's talk a little bit about some of the emotional. I mean, obviously this is a physical issue, but how do you handle it in your office? I mean, do you consult with the patient almost like like a psychologist would in a way, or do you refer out sometimes for that?
No, you have to. I mean, as surgeons, we're still physicians who take care of the whole patient too. And they go through an emotional roller coaster that I can't even imagine. So as part of telling the whole diagnosis, I also try to emphasize the fact that this is treatable. We